Good morning. I'm here at the 69th annual meeting of the American Society of Reproductive Medicine, and I'm presenting my abstract entitled Increased Fat Consumption Exacerbates Metabolic and Behavioral Effects of Polycystic Ovary Syndrome in a Rodent Model. This was research that I did during my fellowship where I studied a rat model of polycystic ovary syndrome, or PCOS, and as we know, this is the most common endocrine condition affecting women of reproductive age. Despite it being a very well-studied condition, not much is known about what the cause of it is. We know that it's associated with elevated male hormones, or androgens, and many of the women are also obese. However, there's a large population who are also lean. So this study was done to help understand what are the causes of the high androgens, high male hormones, versus a high-fat diet to induce obesity. So we had 4 groups. We had a pellet with a hormone called DHT that induced the high male hormone levels. So 2 groups had the DHT pellet and 2 groups had a placebo pellet, and then one of each of these groups was placed on a low-fat diet and a high-fat diet so that we could see what the independent and the synergistic effects of the diet and the DHT were. And we found that the DHT treatment caused increased body weight. We see that the DHT plus high-fat diet had the greatest effect, as well as the greatest amount of fat mass was in these DHT high-fat diet animals. It also disrupted their menstrual cycles, and not only in the rats with the PCOS, but even those who were the controls but on the high-fat diet. We see that many more of those had irregular cycles, noting an effect of just the high-fat diet. We also were interested in what its effects were metabolically, so we looked at their glucose tolerance and insulin levels, and again we saw that the greatest effect was the DHT with the high-fat diet causing impaired glucose handling. We were also interested in what the effects would be on their behavior, because we know that women with PCOS have increased anxiety and depression, and we wanted to test if this was an organic cause, perhaps related to the elevated androgens. So we found that the animals who had the PCOS did have increased anxiety-like behavior, as well as those on high-fat diet had increased depression-like behavior.